Good. Whoa. That's what we needed. While he's taking care of this, I want to introduce myself. My name is Joshua Berka. I'm a physician from the United States. I live in San Diego. And I was just over at the anti-aging, or the longevity aging conference, and it was very good today. But my specialty is, everyone asks me what my specialty is. I'm sure they ask you also. Integrative medicine, functional medicine, trained in both Eastern and Western medicine, and more naturopathic style medicine. So despite me not prescribing drugs all the time, sometimes it's a necessity to do that. And so from my perspective, it's important to do the best job you can do, but do this in a non-invasive way. And this particular product is extremely non-invasive. This is what got me involved with this 11 years ago. In the United States, I've been working with this in clinical practice, so I'm going to review some of the things that I have found within my practice over these years. We'll see if this works. So this will be slow. One of the most important aspects also is here we are, we're living in these modern times also. We have the best technology, we have drugs, we have great hospitals, and my question I always ask myself is why is there so many chronic diseases still going on right now? With all these things we have. Back in the old days, people died of respiratory infections, they died of trauma, but now we're killing ourselves. And this is a fact. Our choices that we're making every single day are having a very big impact on our health as individuals as well as a country. So when we look at this, of course, in my practice, I don't see the iceberg, and you never see icebergs here because it never snows. But to me, this represents what I see and what many of you will see in clinical practice, and these are symptoms. Away. I will do that. The symptoms are at the top. Many people don't come into your medical office with diseases. They come in necessarily with, oh, I have pain here, or I feel tired, or I feel weak. And it's our job to figure out, what do we do? What's the job then? And when we look at the symptomatic expression, we look at aspects of causes. For me, as a naturopathic doctor, it's most important to treat the cause rather than cover up the disease. Drug that blocks the perception of the pain or the disease. And when we look at the aspect of the causes, they're very simple. Most diseases have involvement at the circulatory level. Even though clinically you may not be able to identify this, this is a fact. And when you start looking at circulatory disruptions, then that disrupts the ability to both make energy and to regulate energy. This is called bioenergetics, mitochondrial bioenergetics. This affects cellular metabolism, this affects dysfunction at the cellular, to the tissue, to the organ, and then full circle all the way back up to the symptom. When we look at the causes, as I said before, of many chronic diseases, lack of exercise or moving, poor breathing habits, psychological stressors, environmental stressors, and poor eating habits. Here, this is American presentation, so I put SAD, the standard American diet, which is sad. It's true. And so the common factor that we look at really is poor oxygenation, poor circulation, and this disrupts the ability to make energy. I know this sounds so simple, and many of you have been practicing 10, 15, 20, 25 years. It is this simple. You either have energy or you don't. You regulate the production of energy or you don't. And we're going to talk about this medical device that can help support this. Because the answer is not here, and we know this. Sure, this is an opportunity you can treat people, but the pill, and I always say there's not a pill for every ill. We need alternatives, and many of you are in this room because you recognize the need for alternative or complementary medical therapeutics. This medical device, BEMER, not the car, bio, electric, magnetic, Energy regulation. This is an acronym. Bioelectromagnetic energy regulation. BEMER uses a pulsed electromagnetic field, but it focuses on the vessels, as Roland was speaking about. BEMER is described as a physical vascular therapy. And in fact, I will tell you this standing here today, there's nothing like this product in the entire world, including into space, because I'm involved with also NASA doing some projects to build spacesuits with this particular technology. So you've been listening to the physiology, and maybe some of you want to know, how does this work? How can it be so good? How does it work? I'm going to discuss this. So when we look at physical vascular therapy, BEMER, one of the first things we're going to talk about is where it works. Of course, when you use a pulsed electromagnetic field, you have an effect on all of the body. Any electromagnetic field, like a cell phone, stimulates charged particles, which your body is filled with charged particles. In fact, some of the earliest deploying or application of pulsed electromagnetic field was in non-union fractures, where a fracture is not put together. They would use the pulsed electromagnetic field, and then the bone break or the fracture would come back together. This was many years ago, 1979. So we know this is an effect, and this effect is called an inductive effect, transferring energy. All pulsed electromagnetic fields do this, but the BEMER is unique because the BEMER targets the microvessels. And when I say the microvessels, pre-capillary arterioles. I'm not going to go over the microcirculation too much. Roland did a fantastic job of that. But I do want to talk about the importance of the vessels and blood supply and nutrient delivery to all the cells in the body, as well as removing waste products. Every single process within the human body or all of physiology is energy dependent. We need ATP. I want to talk about these arterioles as well. Is anyone in cardiology in the room? No cardiology, okay. Arterioles, the resistance vessels. And in this, the radius of the arterioles are able to change, close or open, based on the functional needs of the body. So if I'm moving my hand here, the blood flow has to come into my arm. It can't be down here. We only have maybe 5-6 liters of blood in our body, so we have to be able to move that. This guy probably has 6 or 7, though. He's a big guy. But true, we have to be able to move the blood where we need to go based on the metabolic functional needs. And the way that the body does this is not pump, 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 pump. Heart, and maybe you were taught this also in medical school like me, the heart pumps all the blood through the body. No way. How could the heart pump, the little muscle here, pump all the blood through the entire body, 365 days a year, all your life? No way. So, the heart has helpers, smooth muscle cells that are surrounding the vessels, which close them and open them to regulate blood flow. I'm going into this because this is how BEMER works. BEMER activates by stimulating vasomotor function. And Roland's, the picture wasn't so good, but vasomotion is important. Vasomotion is the oscillatory rhythms that are involuntary, they're random, or they are spontaneous. And these are independent of the heart rate, they are independent of the breath and the breathing, independent of cerebral spinal fluid. These things are doing their own thing because they're acting locally within the tissue. This is a video from, and this is what Roland was trying to show here, from intravital microscopy. These are microvessels in the intestinal area showing normal spontaneous vasomotion. This is not pathology. And again, I want you to pay attention to the movement, not of the blood moving through, but the diameter. Because what happens is you start to, either in stressful situations or in normal situations, the vessels have to open and close, and it changes the way the blood flows in hemodynamics. You're going to see them start to get smaller here. And it can even control to reverse the flow of blood, which you're going to watch happen right here. This activity is happening in your body all the time, from your head to your toes, everywhere. But we're not always aware of it. In fact, we're never aware of this. One of the things that breaks down vasomotion over a long time, stress. One of the worst things that affect vasomotion. Other things that affect vasomotion, trauma, gunshot wound. Any surgeons in here doing surgery? Anesthesia also decreases vasomotion. Sepsis stops vasomotion. So we need to be able to bring back or resuscitate this vasomotor function within the body. Like an AED over the heart, BEMER's like a stimulation for the whole body. Okay, now this is the important part. We always prescribe drugs or supplement, and we want to know which mechanism, which lock and key mechanism does this work, and then it affects the body. BEMER is no different, but instead of taking a physical pill, you're exposing your body to a wave form, a pulsed electromagnetic field waveform. And this signal and rhythm, this is a patented waveform that was developed in 1998 and has been being perfected for the past 20 years. It's multidimensional, complex sinusoidal waveform. This is the fundamental basis of what's coming out of that machine out there. It's not everything, because there's more to just a language. Think about this as a language. Now I have to deliver that information to the body via specific information. When delivered in a proprietary way, this waveform triggers the activation of vasomotion, which also increases microcirculation and increases mitochondrial bioenergetics. Example, ATP formation. And it's not anything like a cell phone. You can't just wave a cell phone over the body and that's going to help, even though that's a pulsed electromagnetic field. These positive physiological effects led to the patenting of this waveform and the patenting of the delivery of this waveform. And this is a very, very special signal that is utilized. And this technology is the basis of the BEMER signal. There's also a very unique field distribution. The BEMER body actually emits fields from the upper part of the body, as you can see here, and the lower part of the body. Important. You do not have to have direct field interaction with the body to have a vascular effect. In fact, the nervous system can gather this information and have a neurovascular effect even without direct stimulation. And this is still under research investigation, trying to understand why and how that happens within the body. One thing we do know is BEMER has a profound effect on how blood flows and moves, or hemodynamics. We all know, think about this, artery here, venule here, and capillaries in the middle. This is where the business happens. All the business happens here. Oxygen delivery, nutrient delivery, carbon dioxide removal, lactic acid removal. Not here, not here, within these capillary networks. So I want to dive a little deeper into this circle here. Because when you look at this circle, think about this. This is an artery, arteriole, venule, and this is the capillary area here. BEMER uses or deploys a combination of two frequencies over a timeline that affect the large caliber, so the large caliber precapillary arterioles, and in this affects those sphincters, the opening and closer. Is everyone familiar with like beta blocker for hypertension? Okay. So these are alpha and beta receptors located here. BEMER is also working for resonance. And as it does this, this controls the opening and closing of the vessels neurologically. Also, it utilizes another frequency combination, which is triggering nitric oxide. Roland spoke about Ignaro and his understanding and teachings in the discovery of nitric oxide. Nitric oxide, we know, is a potent vasodilator. It opens the vessels. In fact, it was back when I was in med school that I was taught that the brain controls it all. And then I learned, there's something that can override, and it's outside through nitric oxide, and it can override the brain, and this is that nitric oxide system. So it's the combination of the closing that creates or maintains or supports the physiological mechanisms of microcirculation. So the outcomes, and this is why you're all here. Most of you are clinicians. You see patients, yes? Okay. So these 4 parameters of microcirculation that Roland brought up were vasomotion, capillary perfusion, venous return, and of course oxygenation of the tissues. In addition, they were looked at, when we look at sports, ATP was measured as well. So you don't have to be a sick person to use this BEMER. In fact, many athletes, in the United States, I work with many professional athletes. In Europe, or rather, there's many in Europe as well, and also in Brazil, Nancy has been starting to work with athletes as well. Everyone at one point of their life, if not now, is athletic. They do things, and I don't care if you're in the gym or doing sport, or if you're a grandmother, or a mother, or a father, or a grandfather. It takes work every day to show up and to be present. Whether you're with family, whether you're with patients, it doesn't matter. And that takes energy. So the faster you can recover, the faster you can regenerate. And the faster you can recover, the better you can perform. No one in this room or anywhere can perform over and over without recovering. This is the nature of physiology of the human being. So BEMER helps with recovery, regeneration, and supports increased performance. And many people say, oh, you know what, I'm an athlete, I don't need anything like that. I'm very healthy. This is a picture of a 23-year-old athlete. And these are, I just want to give you an idea before I play the video. This is a capillary network that's you're seeing here with an arteriole running through. And this is like I said, a 25-year-old athlete, and he has disturbed microcirculation. You're going to be able to see. After using the BEMER, you will see the change in the velocity or the hemodynamics or blood flow. And you will see that by the change of color. And I have heard people say, oh, maybe this is just sped up or the camera. Let me tell you, this is live video footage inside of the human body called intravital microscopy. And you can see before, after here. You can see the red blood cells, just kind of moving along. BEMER not only affects the vessel, it also affects what's inside the vessel. The milieu, the components, the fluid movement. Check. Good. So this was a study, and I'm not going to spend a lot of time on the studies. I will tell you where to find them. Any study that I have up here, you can find on pubmed.gov. And you can, when you Google in, you can write BEMER vascular therapy, and you will see many of the studies that I will do. But this is looking at oxygen affinity, ATP formation within the human body, utilizing the BEMER. Rehab. I see a lot of patients post-surgery, trauma, and they always say, how can I get better faster? You don't have to be, again, the top athlete to say, hey, get me out on the soccer or the football field. Even to just show up and do work in the clinic or at home. So when you look at rehabilitation, wound healing, anyone who doing surgery is making cuts. They're making images. And I'm going to show you some wounds as well. Improved bone healing. I talked about pulsed electromagnetic fields many years ago being used for bone healing. Would you believe me, standing up here right now, 4 months ago, broken shoulder, broken pelvis, torn trapezius, downhill mountain biking accident in Colorado. The doctors told me your fracture, 12 weeks. I went back in 4 weeks, and it was completely sealed. And when I mean completely sealed, not a big calcification like a big bump over, but sealed nicely, tight. So when we look at that, again, performance healing and reduction of rehabilitation times. You know, any clinician wants the patient to come in so they can spend money so they can see them, but I promise you it's better to get more patients in who are talking about how good you are. And when you're using this product, you will be a star because you will get people better faster. So this is a study that looked at vasomotion in patients various ages undergoing rehabilitation. And I'm only going to look at the results here. The results showed that these older rehabilitation, and when I say older, 50s, mid-50s, 60s, rehabilitation patients, they looked at microcirculatory changes. These were greater than younger people. Younger people have better microcirculation. They're in better health. That doesn't mean they don't need it, but the older people need it more. So the best patients for sure are, as they get older, the microcirculation vasomotion decreases, and so the need for a supplementation like this is very crucial. So this is looking at vasomotion, and you can see the effects right here. Illness. There is almost no illness that I would not use the BEMER with. There's one major contraindication you have to be careful with, because BEMER doesn't just stimulate the vessels, it also stimulates the leukocyte, the white blood cell. It enhances, it doesn't make more of them, it actually stimulates them to mobilize, to move. And so when you look at illness, the only thing that is contraindicated are individuals who have had an organ or tissue transplant and are taking immunosuppressive medication to stop that rejection. BEMER is going to stimulate the white blood cell, it's going to stimulate the immune system, and you don't want this in that case. But this is one of the only times I don't use BEMER. So when you look at this, faster healing processes, improved effects of medication, and increased overall health. BEMER is not magic. BEMER supports your self-regulating mechanisms that are innate, that we're born with. It doesn't make you a superhuman athlete. It makes you effective and efficient at your highest level. This is a study that was done on MS patients, multiple sclerosis. And these individuals were looked at not for the neurological degeneration aspect, but physically, the symptoms. How did they feel? The fatigue, tired. Was that improved when they were using the BEMER or not? These treatments were done on 37 test subjects, 8 minutes, twice a day, for 12 weeks. The results conclusively showed using BEMER decreases the fatigue in those individuals with multiple sclerosis. In fact, it was so successful that they took it was a double-blind placebo-controlled trial, they took the placebo-blinded and they crossed over and allowed these people to come into the study. And they also had the same type of effect. For me, this is not surprising, because fatigue is directly related to energy, and energy is directly related to mitochondria function. So as you enhance mitochondrial bioenergetics, you support the body's overall energy, which the perception is, I feel better, I have less fatigue. Okay, so this is a polyneuropathy study that was done. Does anyone see neuropathy patients? I'm sure? Okay. Whether this is a neuropathy that is generated from chemotherapy or from diabetes type 2, to me it doesn't matter. Those are damaged nerves. End of story. How do we bring those nerves back to life? One, they need raw materials, special food. For me, I supplement, I'm using things like B6, pyridoxine, B12, conjugated linolenic acid, these type of things, fish oils. These are the raw materials, but now is the question. How do we get those nutrients to the tissue if they have poor blood circulation? Sure, you can eat them, you can swallow them, you can then assimilate them, but what if I have poor circulation in my toes where the neuropathy is? Those nutrients never get there. And so by using something like BEMER, you can enhance the bioavailability or the usability of these products. Whether it's nutraceutical, pharmaceutical, taking it by mouth, by IV, it doesn't matter. So yeah, this study looked at the aspects of polyneuropathy, and they looked at a few different things. One of the ways that BEMER stimulates the rolling or the moving of white blood cells is stimulating something called ICAM1, intracellular adhesion molecule 1. And these are involved with how the white blood cells roll across the endothelial lining of the vessel. So this showed an increase in ICAM-1, increase in vasomotor function here, or PO2. This is change in partial pressure of oxygen. This one here was ICAM-1. Okay, clinical cases. What you've been waiting for. This is a... Oh, we'll get back. Okay, diabetic leg. So this is someone that has type 2 diabetes, chronic, long-term. And you can see here, this is an ulceration, but I want you to also pay special attention to the surrounding tissue. Purple, dark, dead blood cells. That's stasis dermatitis. That's the diagnosis here. And this is from poor blood flow. This person moving around is not going to increase the blood flow there necessarily because it hurts and it's going to be difficult. So this diabetic ulcer with stasis dermatitis, this individual was treated with the BEMER twice a day after 4 weeks, after 8 weeks. This, 16 months old, over a year old that did not heal. They started to do the BEMER every day, 4 weeks, 8 weeks. Don't just look here. Look at the surrounding tissue, the color, the pink. That's good blood flow. That's poor blood flow. I always say for those individuals who are getting older, over 50, I'm not there yet, but it's true, as we get older, it gets difficult to recover. And recovery, like I said, is extremely important for performance. So as you get, and it doesn't matter if it's physical, if it's mental, performance is important. And so you can look at greater capacities for healing, increased physical defenses, and most importantly, what I've seen in my patients are increased cognitive improvement. And this can be at a very low level, or I've worked with dementia, I've worked with Alzheimer's, neurological degenerative diseases, Parkinson's, anything that's helping blood flow to the cranial region. And you can also use this product transcranial, that means around the brain. Very good effects. And for me, prevention is one of the most important parts of medicine. And so when we look at this aspect of, and again, you can look up this study, I'm not going to go into details, but when they looked at these aspects, both the microcirculatory blood flow regulation as well as the cellular immune response could only be affected by one type of therapy, like this pulsed electromagnetic field therapy that stimulates vasomotion microcirculation, the BEMER. Same thing, this was looking at here, arterial vasomotion increased immensely. This was looking at the ICAM-1, the intracellular adhesion molecule 1, and this is for the roll action of the white blood cells. And they also looked at this one, looking at the transmigration of white blood cells. That means the white blood cells that are stopping and transmigrating through the vessels into whatever target that is, a virus, a bacteria. So increased work is being done by the white blood cells when using the BEMER. I spoke a little bit about prevention, and BEMER has showed to play a really important role in prevention. As we increase the production of blood, this increases your ability of your immune system to fight, to protect. And this is one of the things with stress that goes down, with not sleeping well goes down, with not eating well goes down, with not thinking well goes down. So BEMER helps not just affect the vessel, but you have to think, how does this do this? BEMER also helps to regulate the autonomic nervous system, sympathetic, parasympathetic nervous system. Not through the front door, the back door, working with the vasomotion through the neurological reactions that are happening with the vessels. And this is an effect that even though it's happening peripherally outside of the body, there's still an effect centrally within the brain. So BEMER not only reduces the susceptibility to infections, but also strengthens your body's physical defenses. So I told you that I am also, I do acupuncture, Chinese medicine. It says maintaining order rather than correcting disorder is the ultimate principle of wisdom. To cure disease after it has already appeared is like to dig a well when one feels thirsty, or to make a weapon when the war has already begun. Isn't this already too late? 3,000 years ago, this was written in the Huangdi Neijing, Yellow Emperor's Classic of Internal Medicine. They knew this problem of prevention then, and we still see this today. I want to just briefly talk about sleep. And I don't know, I missed the lecture today on sleep. I don't know if anyone saw it, but to me, there's nothing more important than one, breathing. Next, sleeping. If you are not sleeping and recovering, you're dying. It's that simple. Take a look at this. Myocardial infarction. This was not 5 people. 52,610 individuals were studied. And they looked at their sleep cycles and rhythm. What they found was very, very interesting. In fact, as you look down here, it says, conclusion, insomnia was associated with a moderately increased for acute myocardial infarctions. That means if you're not sleeping well, you're at a higher risk for dying of a heart attack. Who would have thought that sleep has an effect of your heart? It certainly does. And not just the heart, the microvessels also. So sleeping is very important, and BEMER recognized this. And so they created not just a program for the daytime use in the clinic or at home, but also a sleep program. There's 2 separate phases of how blood flows in the body. In the active stage of the day, we want most of the blood in the brain, in the muscles, digestive system. At night, we want it in the liver, kidney, spleen, organs of detoxification. Does that make sense? Okay? So BEMER set this sleep program up that you can integrate this when you're sleeping to help regulate the circadian rhythms. These diurnal variations, sleep-wake cycles. I will say you don't have to do the sleep program to have improvements with sleep, though. That's important to know. Many people, my patients, will use the BEMER in the daytime and they say, hey, Dr. Berka, I'm sleeping better. What's going on? Because it's balancing the autonomic regulation, the nervous system. So BEMER uses a low level at night. Instead of using the 2 frequencies, it uses only 1. Very low power. When you go to sleep, it's on for 2 hours when you go to sleep, and then it goes off. And then when you wake up, 2 hours before, it comes back on. So it helps to take you to sleep and then bring you back out while letting your body naturally sleep during the most important phases of these delta rhythms, the deep sleep. So this particular therapy, BEMER, is really one of the most researched, most effective physical treatment methods that exist. It's distributed through Europe, it's distributed through the United States, it's distributed through Brazil, many, many countries across the United States. I want to talk to you about a patient that I have. So it's a clinical case. This is a 46-year-old female. She had, on this side of her face, a parotid tumor. So a tumor of the saliva gland, yes. And this was my patient, and I said, why do you think this happened? I mean, she was, what do you call it, the hair cutter, the beautician. So she would make the hair cut, but also, I have seen more of these in my practice, and I said, why now? Why more now than before? And all I can think of is I see this happening so much. Cell phones are electromagnetic energy, and not the good kind. Not the good kind. These have detrimental effects on your body. Whether this is known about in Brazil or not, I'm telling you, for sure, there are mitochondrial dysfunctions that arise from the close usage of cell phones. In fact, if you open your iPhone and you go into General, and you go to About, and you go down into RF exposure, and then you go to Legal, it will say never take your cell phone and put it on your body, anywhere. 5 millimeter. This is written. You never see the commercial of anyone, hey, dancing around. They have their phone out here with a wire. I'm saying this because so many people don't know. And if you don't care and you're an adult, that's fine. I don't care about you. But children I do care about. And if children are putting iPhones on their gonads or they're developing organs, this is a very bad idea. Anyway, back to this young lady. So Bell's palsy, she had surgery, and the tumor was cut out, But the surgeon probably was a good surgeon, but he cut the nerve. And so this whole side of the face, I asked her now to smile. She cannot smile. This side is paralyzed. This is the surgical incision, which Kate took out the parotid tumor. And you can see it's not so bad. It was after the stitches already came out, but I did not see her for 1 month after the surgery. And at this point, she came to me and she was crying. Very sad. She said, I can't sleep at night. I asked her to close her eyes. She couldn't even, her eye wouldn't close. She was going crazy. She said she was going to kill herself to me. I said, no, no, no. We will try this first. So, we used the BEMER on the full body. Even though the problem is here, I wanted to use the full body because this stimulates the circulation throughout the entire body. And we used one of the applicators called B-Spot right in this area using program 1. Every day, twice a day, for 1 month. This is 4 weeks. Oh, one more. We used light, the B-Light, 660 nanometer red light. And this was also used over this twice a day for 4-minute increments. So you can already see the difference here. And this is not normal healing after 4 weeks. I will let you know you understand this because you also have a little darker skin. This woman is from Mexican origin, so she has a tendency to make keloid. You know this word, yeah. So this was a beautiful healing. And not only did her physical heal, her physical body, she was back again. And so this is one example of one case, a nerve damage, but there's so many cases that I can give you. This is Rita, before and after. I want to show you another clinical result here. This is a macula. So for the eyes, you can also use the BEMER. Believe it or not, the eyes have more circulatory vessels, microcirculation, than anywhere else in the body. There's so many inside of the eye. So you can understand, I mean, when I was in medical school, they said, hey, look inside of the body, you can see what's going on in the heart. Also, it's one of the first places you can see diseases. As you can see here, this is normal macula, macular degeneration. You can see the drusen, or the inflammation, the scarring that's happening here. This individual used the B-body. These images I'm going to show you are at 2 months and 9 months, as well as using the B-spot over the eye. So look at this change here. And almost nothing. The also difference was this person could then see. That's a big deal. Especially if someone is dependent on everything is blurry or they're going to lose their sight. Not good. Okay, so when we look at this, this is also a patient of mine. What you're looking at is, believe it or not, this area, sacrum. This person was in a wheelchair, and he went to war. He was in Iraq, in the Middle East, and he came back with, to this day, I don't know what it was. I think it was a biological type of warfare that was being done, maybe mycoplasma or something. I never found out. All I know is he came to me, and it didn't look like this at first. This is good. It looked like this after I used medical maggots. I put the medical maggots in and covered it so the medical maggots would eat the dying tissue, the decayed tissue. This was his leg from rubbing on the wheelchair. And look at this color. No circulation. He's in the wheelchair. How can he have good circulation? So in this particular case, you can see this is necrosis. Dying tissue right here. And this is all stasis dermatitis, and this is an ulcer. So this is what they all looked like together. 6 weeks. This wasn't healing at all. He went to the Veterans Affairs. He was a military person. They could not do anything for him. All I used was the BEMER over his body in the wheelchair. You don't have to lay on the BEMER to have an effect. You can put the BEMER on top of you also. And he used the B-pad around this area and also used the light again. The B-light, 660 nanometer red light. All of them work very, very nice together. And he was doing some naturopathic protocols, anti-inflammatories, these type of things. So when you look at this change, this here is not just a little hole. This hole, to this hole, to this hole, everything was connected underneath. This was tunnel. And so this healed through second intention from underneath and up. Very powerful case here. This was his leg here after 6 weeks also. You can see the change of the color right here from dark to pink or a lighter color. That means good circulation. This necrotic spot is only a little dot now. This here, this color, is not an infection. His wife was also using curcuma, turmeric, like a poultice to put over. And so this is the discoloration from the herbal therapy also. So again, here they are after, completely. So I don't want you to just listen to me and say, oh, this doctor, he's doing this, doing that. There are thousands of physicians, doctors, clinicians, home people. You don't have to be a doctor to use this, okay? High level of acceptance of therapists throughout the world. When you think of things that you can treat for yourself or in your practice, there's many, many possibilities. All you have to do, and it's very easy to do, press the button, lay down, and it begins to work. It's very, very simple. It's not like an ultrasound where you have to be there and someone has to be watching and you have to be moving it all the time. Or a class 4 laser, for example, which can be very dangerous if you don't know what you're doing. Very safe, very effective. I talked about sleep, and I said if you're not sleeping, you're dying. Movement is also the most important part of life. We have to move. And not just in our body to move and exercise, we also have to be thinking. We have to be breathing. And this is all so important to have a good, proper, vital, high life. There's another contraindication that I want to bring up. And again, it's not a contraindication, but it's something to be cautious about. If an individual has an implant, defibrillator, if they have a pacemaker, if they have a deep brain stimulator in their brain or something, you should use caution when using the BEMER and speak with the doctor to make sure that they can track if there's any changes. Okay? Also, there's another one with a blood thinner called Coumadin. Warfarin, are you familiar with this? They should always check, and again, this is an old drug, but sometimes it's used. They should always check the prothrombin time, the PTT, or INR, on weeks 2, 4, and 6 weeks, and that's only if they're using it every single day. And the reason is because sometimes that medication needs to be decreased or even discontinued because the BEMER helps to thin the blood also, naturally. This gentleman, does anyone recognize him? Aha. Serbian-American inventor Nikola Tesla. He says here that the day science begins to study non-physical phenomenon, it will make more progress in 1 decade, so 10 years, than in all previous centuries of existence. We are in this time now. So much technology is coming out. And it's not just BEMER, but also pharmaceutical companies are starting to come in and make products that are utilized and together with electromagnetic energy. Nanoparticles, nanotechnology integrated with maybe a cell phone that you can put an app and you take the blood, you take the drug in your body or inject it, and these are floating in your body, and then you hit the app and it pulses a field and activates that for a certain amount of time. This is coming. That I promise. There's a final quote that I want to leave you that Tesla said. He said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. Energy, frequency, and vibration. And I don't care what your background is, whether you're a molecular biologist, geneticist, the fact of the matter is, everything is energy. Everything is energy. You either transfer energy, chemical energy, heat, cold. It can't be created or destroyed, it can only be transferred. So it's important that we are transferring the appropriate energy, both from ourselves as clinicians, to our patients, and also using appropriate and safe medical devices to do so. So the choice is easy. There's some people that use BEMER in here already. If you haven't tried this, try this today. If you are interested in it, speak to Nancy. You're in this room for a reason, and this is something that I want you to at least consider utilizing in your clinical practice. Because even though it's new and it may sound like, oh, it's kind of out there, airy-fairy energy stuff, this is important. And I wouldn't stand up here today. Like I said, as a physician, I can prescribe drugs, I can do anything. Why would I do something like this? Because there's nothing like this therapy that exists. And here's what's more important. Wherever state in Brazil you're from, it doesn't matter also. Because it's so new in Brazil that if you're using it, I can promise you no one else around you is using it. You will create a niche, a special place for people to come and use this. And that also generates income. Just because we're doctors doesn't mean we have to be poor. We can make money, right? Of course. All right. Oh, look at that. We did it. So, I think Nancy, was there some other physicians, doctors that were going to be talking, or are we going to do a question and answer?
Eu gostaria só de contribuir que nós temos o BEMER desde novembro e eu faço uma técnica de medida do campo energético através ou de bidigital Orient Test ou radiestesia. Os dois métodos são superponíveis. Muito bem. Eu meço antes do BEMER e depois. E isso mostra para mim a resposta. Porque, normalmente, a medida de um campo energético fica na média, entre 1,5 passo a 6, 7 passos. Dependendo do estado físico e das condições de saúde, maior é o campo energético. Muito bem. Esse paciente, feito a indicação, ele entra no BEMER, fazendo a maca. Depois de 8 minutos, até 8 minutos, que é o primeiro nível, a gente não consegue muito efeito. Mas com 20 minutos, nós chegamos a medir 50 passos. Se for num tratamento clínico, sem o BEMER, eu levaria de média uns 4 a 5 meses para dar, no máximo, 20 passos, só do ponto de vista de melhora do organismo, tornando o organismo o mais sadio possível. Então, eu quero contribuir com você. O BEMER é o melhor aparelho que eu vi até agora. Era só isso.
Thank you. Or, muito obrigado.
Eu gostaria de fazer uma pergunta, porque eu tenho feito muita terapia endovenosa juntamente com o BEMER. E você faz junto, antes, durante ou depois? Se você tem alguma experiência, porque eu sempre associo terapias ao mesmo tempo com o BEMER. Às vezes eu faço antes a terapia para fazer uma vasodilatação, como às vezes biopuntura ou infiltração, ou biopuntura ou PRP. E qual que é a sua questão em você fazer junto ou não?
That's a really excellent question and clinically relevant as well. So it's very interesting. You have to think of this as a clinician, critical thinking skills. So for instance, if I'm doing biopuncture, PRP, stem cell therapy, what I do is first, before the therapy, I prep. So say I'm doing shoulder. I prep the shoulder, 8 minutes, program 1. Okay? Boom. Inject. After, finish also with program 1 for 8 minutes. Then, they either use it at home, or they come back to the clinic on day 1, so the next day, 2 days later, and then 2 days later. So a total of 3 times in a 5-day window to help amplify. And it's whether it's the shoulder, the knee, it doesn't matter. You should use the full body as well as one of the applicators for that particular aspect. This can also be done with IV at the same time. If you're doing an intravenous therapy and you're utilizing the BEMER, you can use the whole body to stimulate over the systemic blood flow. For instance, say I'm doing a glutathione push and I want to push this to the brain. Of course, I'm going to push this into the bloodstream, but if there's issues or problems with blood perfusion, it's not going to have the best effect. So then I use the BEMER around the head and utilize a lower program like a program 1. And this enhances the bioavailability of those substances. Okay? Yeah, the question was, is it possible to use deep oxygen therapy, like hyperbaric oxygen or like EWAT? Okay. Yes. Okay. Does everyone understand the question? Okay. Yes. Okay. No. He says, breathing oxygen therapy, can you use this with the BEMER? Of course, if you're enhancing the blood flow of the body and you're then breathing in oxygen, you're going to deliver more of that oxygen to the target tissue. So whether this is being done as an athlete or this is being done as someone laying in the chair, for me it doesn't matter. You're going to be able to enhance that availability. Are you going to do a pulse oximeter and see that change? Not unless someone is in very bad health. But you're going to definitely be able to not just take it in through the lungs, but also perfuse that through the body delivery. So excellent, and this is actually a new thing that is starting to be done in many clinics, is utilizing oxygen and BEMER combined. Great question. Sir.
Eu gostaria de saber a lógica dos programas. Programa 1, programa 2, programa 3, programa 4, e eu posso fazer qualquer programa. Eu queria entender a racionalidade por trás de como fazer um programa e como usar os diversos programas.
Great. Good. Here. So, the programs are very specific. The programs include the intensity levels. Ladies and gentlemen, this is no different than any other drug or any other ultrasound. You're delivering a dosage. And you control your dosage based on two things. One, the intensity, i.e. the 10 levels, also the programs, and the time that individual spends within the field. That controls the dosage. The nice thing about BEMER is it has a very big therapeutic window. So it's very hard to overdose. So the idea is, for example, you said, when do I use a program 1 versus a program 2 versus a program 3? This is one case where power is not the best. The right dosage is. And so, for instance, if I want to penetrate through the wrists, for example, or I showed you the face, and I kept saying program 1. Program 1 is 2 minutes level 2, 2 minutes level 3, and 4 minutes level 4, increasing intensity. That means that it starts here, and then it will go deeper, deeper, deeper. And that's what we want with the programs for the applicators only. The body should be used on one of those 10 levels, ideally one of the 6 levels, because we want to maintain the same flux or the field in a homogeneous or the same way to stimulate the systemic microcirculation. And the applicators are designed for specific application for regions. So for Roland, for example, or this gentleman here who's a little bigger guy, maybe I would use a program 2 for his shoulder, for example. Or for the waist, maybe a program 3. But, and this is important, size doesn't mean everything. You have to take into consideration the health of that individual. Is this a 56-year-old individual who's obese with type 2 diabetes and cardiac problems? Yeah, you don't use program 3 with him, or a level 10. Maybe a level 3, 4, 5 like this. Maybe a program 1 or maybe a 2. But you want to stay at the lower levels. And I always say people, start low and go slow. You can still have an effect by using low power. In fact, sometimes the low power gives you better effect than the high power. Example though, broken bone like me, boom, program 3, program 3. More power to stimulate the piezoelectric effect. I don't know if you can translate that, but this is the electricity that moves through the bones, the electricity that moves through the fascia. This is piezoelectricity. So is there an exact protocol for this disease you use program 2? For this one, you have to use your own clinical judgment in this situation. That's the best I can say. And it has to do with the severity of the disease as well as the depth of penetration that that individual wants. Okay.
Pelo que eu entendi também, o tempo o tempo dos programas, parece que é mais importante fazer pequenos programas várias vezes do que um programa por muito tempo?
Bingo. Or, yes. You're better off using short programs and say, for instance, 8 minutes on the body, 8 minutes here, 16 minutes here, rather than 20 minutes on the body. You never need to do 20 minutes on the body. Truly. These effects that were shown with the videos, these happen at 2 minutes, 4 minutes, 6 minutes. So if you're going to do this, I mean, you can do whatever you want. But the best effects will happen when you use the B body on one of the levels for 8 minutes. And then you use the special applicators, the B pad, B spot. And yeah, you can do 20 minutes with that or 16 minutes. But the B body should be 8 minutes. That's the general guideline and rule. But as a physician, a clinician, you can do whatever you want. I'm just giving you my 10 years, 11 years of experience.
E minha última pergunta é sobre pacientes com câncer. Se teria contraindicação em pacientes com câncer?
Yeah. So cancer or oncology is not a contraindication. However, it's recommended that if someone is receiving cancer treatments, radiation, chemotherapy, they should not use the BEMER unless either the oncologist or urologist, if it's prostate cancer, understands what's being done. Because there's a therapeutic window of like chemotherapy, for example. There's a specific amount of time that drug should be inside of the body to work. And by using BEMER, you can speed that process up to clear these drugs. I've also seen this with pain medication. Too much BEMER can clear the pain medication quicker. So, and I'll let you know, I worked 5 years in oncology in Los Angeles. And I did use the BEMER on many cancer patients, even sometimes directly over the tumor with the doctor. Meaning I said, hey, okay, we're doing this. You're going to dose chemotherapy today. I'm going to drive that chemotherapy to the target tissue. However, again, I want to say this. This is off-label usage and is not recommended unless you're a physician, a treating doctor, a clinician. Then it's on your medical license. But the company's stance is BEMER is not a cancer therapy, but it is a vascular therapy. I get a lot of oncologists also asking me about angiogenesis. Oh, I don't want to use the BEMER because we will make new blood vessels. Then that person maybe shouldn't go exercise, or maybe they shouldn't walk around. These are the same doctors that tell me, oh, I don't want them to get a massage. This doesn't make sense to me. I want to bring oxygen to those target tissues for a cancer patient, and that happens via blood supply. Now, there's disruptions, of course, in those cells as far as them moving and using glucose for different effects and growth, but in 20 years of the company, and me, 11 years, one of my jobs is something called post-market surveillance, where I'm looking at thousands of users. I have not found a single case where BEMER has caused carcinogenesis or cancer or metastasis. So it's very safe. It just should be utilized by someone who really understands cancer and oncology and not by just everyone. Okay? So this is not a contraindication, but it's under the warnings and precautions. Okay?
Doc, com a experiência que o senhor tem, quais são os programas que o senhor determina para casos de atleta, AVC, câncer, né, esclerose múltipla, Alzheimer e Parkinson?
So, that's a lot of diseases. Good news. I was going to say I only have one answer, but I have two answers. For everything but the athlete, I generally would use the basic plan, which is using one of the levels 1, 2, 3, 4, 5, 6, and changing every week. The reason why you're changing the levels after using it every week is so the body doesn't accommodate. But if someone is coming into your clinical practice maybe once a week or twice a week, then you can use other levels. But for athletes, generally higher levels, 6, 7, 8, 9, 10, for example. Never do I do this with individuals with MS or Parkinson's or anything. What I do is I stick with the 8 minutes, and then with the athlete, I will run, for instance, the B pad up the spine without the B body, separate, 20 minutes P3. And I do this before they're going to train, before they're going to do work to enhance their energy. Also, I do a cool down with them on maybe a level 1 or 2 after they're done with training. Individuals with you want to target the brain, for example, Parkinson's, multiple sclerosis, again, the full body, and then you would wrap the B pad around the brain, program 1, usually without the plus signal, or running it down the spine with one of the coils behind the head here, program 1 also. Anytime I'm using the BEMER above the head, there's no need to ever use anything higher than a program 1. It doesn't matter how thick anyone's skull is, or their, you know what I mean, the thickness, or how big your head is. The BEMER will penetrate through anyone's head, and I can show you this very easy. Program 1, you can put it here, you can put the sensor, and it will beep. So that's the goal, is to provide enough energy, but not too much. Did that answer?
Thank you.
Okay. And again, I answered the cancer patient case, or for instance, Lyme disease, or people who are very sick. I only use these low levels, levels 1, 2, 3 maybe, in program 1. Because if I don't, sometimes I can push them into a detox process where they're sick and they have headaches maybe, or myalgia. But again, you can use this in your practice however you feel comfortable. This is just my experience.
Eu tenho uma pergunta novamente a respeito de usar o BEMER no pacientes oncológicos. Eu tenho tratado pacientes oncológicos há mais ou menos uns 17, 18 anos. E o que eu vi com o BEMER agora é que ele tem um processo de detox e, ao mesmo tempo, ele tem um processo de aumento da vascularização. Então, quando a gente, às vezes, vai fazer altas doses de ácido ascórbico ou ácido alfa-lipoico ou quelação, ele ajuda bastante o paciente nisso. Eu já tenho bastante pacientes com adenocarcinoma de cólon com metástase hepática e agora livre de doença depois de 3 meses. Estava com CEA de 430, agora está com CEA de 2,5. Metástase hepática, ele tinha nódulos até 5 centímetros e agora está 100. Então, depende do protocolo, acho que a gente usa o efeito do BEMER em associação com o que a gente quer. Em relação ao Parkinson também, eu percebi que você usando tempos menores com potência menor, para ativar o sistema nervoso central, eu faço com tempos menores. Mas no corpo, dependendo se o paciente tem um estoque de energia maior, eu faço mais tempo. Se ele tiver menor, eu faço menos tempo.
Beautiful. Yeah, that's very good advice. Excellent. And here's what I want to say. How long have you been using the BEMER?
6 months.
6 months. I've been using this 11 years. The only way you're going to really understand how to use this is to put it on patients to use.
I'm using PMF. Do you know PMF?
Oh yeah, pulse electromagnetic field, right.
I've been using it for around 15 years. But the BEMER is kind of different because it's so soft. I think the soft way is better.
It's more targeted. Yeah, it's like a sledgehammer, a big one, versus...
I think it's better.
Yeah. Very nice. Thank you for your input. That was very helpful.
Boa noite. Eu gostaria de saber se o senhor tem alguma experiência em relação à esclerose lateral amiotrófica e BEMER e também sobre déficit de atenção, caso de criança.
Attention deficit disorder.
Oh, ADD, ADHD. Okay, okay. So, honestly, I have only probably treated a handful of ALS patients, so I don't have a lot of experience with ALS. But it is a degenerative nervous disease. And so when we're working with a degenerative neurological disease, I treat it the same way with the BEMER that I would with anything else. I would use the full body applicator, basic plan, and then I run this up the spine, the B-pad, sometimes program 1, sometimes program 2, after the B-body. And so this is what I do, twice a day usually. And as far as ADHD, ADD, many people that use the BEMER will wrap the head. But my question to you is, why do you think a child's problem, ADD, ADHD, is in the head? I don't think so. I think it's here. And I also think it's outside here. Parents, people, community. I tell these children to speak up. Yell, act out. You follow me? This is a problem not of a child. This is a problem of a system. And so when I look at this, I really focus towards the gut. And you can lay on the bee body, and you can put the bee pad here, program 1. If you want to use it, you can use it over the head also, program 1. But, you know, the main focus that I look at, and I do a lot of genetic testing as well. And so I look at, is there preposition? Is somebody have genetics that predispose them either through poor methylation, or they have genetics that don't allow them to detoxify certain hormones or certain neurotransmitters better than the next person. And so I look at these and try to supplement where it's needed, and also make recommendations on lifestyle. And BEMER is one of those cases where it's not just a clinical application, but it could be used for lifestyle, for home use. And I know that's not happening much here in Brazil, but this is really the best way, is to do this on a daily basis, if possible. If not, to try to get them exposed more. But good question, thank you.
A pergunta foi já respondida, mas eu penso que eu gostaria de ter melhor clarear mais o que a empresa com 20 anos pensa, e para que a gente possa ter uma relação mais clara em relação ao tempo, a intensidade em relação à gravidade de um paciente em termos mais grave, mais tempo, menos tempo, curtos. Só novamente bater sobre isso, não exatamente sobre doenças crônicas específicas, mas em relação ao time e à frequência, à gravidade do paciente. Novamente, é porque realmente não ficou claro para mim. E o autismo também, só porque isso aí é outra coisa, né? Mas como falando especificamente, o autismo também, se temos experiências mais profundas em relação à melhoria. Mas já está encaminhada a resposta, mas o que poderia...
Very good question. Let's go backwards. Let's talk about autism for a second. Because so many people think that autism, again, is a brain problem. And for me, clinically, I've worked with many people, children and adults, on the autism spectrum, with autism spectrum disorder. And it's not only just a brain problem. Again, back to the gut, I do this. So then the question is, which protocol do I use for autistic patient? I can't answer that. He can't answer that. No one can answer that. And the reason I say this is because every single person in here is different. And if all of you had the exact same diagnosis, I'm not going to treat you all the same. Because back to the original question, what is my specialty? My specialty is people, not diseases. And so when I look at this aspect of a human being, I look at what can I utilize the BEMER for to trigger this response. Mostly for children, I use lower levels. 1, 2, 3, 4, program 1. And I don't go over that. But I also know practitioners, clinicians, who use higher levels and also get good results. So you're asking, we want protocols, and after 20 years, why don't you have more protocols? Because BEMER is not a disease-specific device. I could ask the same thing if I worked with laser or ultrasound. How much dosage should I do for this particular problem, for this problem? Again, that's a clinical judgment that needs to be used. So the company offers general guidelines, not disease-specific applications. That's the best answer I can give you, unfortunately.
Eu acho que eu não quero protocolo, exatamente o contrário. Eu quero dizer, novamente, como o Rogério falou, qual é a lógica que foi pensada dentro da empresa em relação à lógica de trabalharmos. Exatamente o oposto. Em time, frequência, gravidade das patologias, em geral.
I understand what you mean now. So, you said when you say frequency, the frequencies are fixed in the BEMER. They use a couple different frequencies. But if you're talking about how much, how many times frequency, this is a good question. Because in general, chronic diseases should be used at lower levels for shorter periods of time. Chronic disease, or rather acute disease, can be used at higher levels for longer periods of time. And this is a general guideline that I tell people. But you will know, for instance, I said I had surgery. I know when I overdosed this shoulder because instead of it being a little sore, I was like, ooh, too much. And so you have to let your experience and your patients be that guide. But like I said, in general, if someone is more chronic, keep it low, power, and move shorter times. The acute, you can use higher powers and you can go longer. But the health of that individual is the most important determinant of what level or program you use. So what intensity, or what's called a flux density, the power. The idea behind this is through scientific method. It's through treating so many patients, and they said, how do you think these programs even happened? These programs were put together because I said, for instance, program 1 is level 2, 3, and 4, increasing in intensity. Same thing with program 2. Program 3 is 6, 7, 8, 9, 10. So if I want a higher power to go through the body or stimulate more, I'm going to use these higher. If I'm just trying to relax someone, or if someone's not in good health, I'm not going to tell somebody who's in bad health to go walk 5 kilometers. No. I will say, you know what, start with just walking down the hall and then build yourself that way. And the treatment of BEMER is the same. It's no different. You graduate or work up. Okay? Yes, sir.
Tem alguma contraindicação para mulheres gestantes ou, pelo contrário, alguma indicação já pensada? Especificamente, restrição de crescimento intrauterino tem tudo a ver com a microvascularização, né?
Yeah. Correct. So, in the United States, me in California, I never treat pregnant women because of this. If the baby dies, I know the BEMER did not cause this, me. But what can I do when a lawyer is like, I don't use therapies on diseases or patients unless I can stand in a courtroom and say, this is why I did it as a doctor and physician. BEMER in the United States, I don't use with pregnancy. However, in Europe and other people, like for instance my family, sure I will use BEMER during pregnancy, especially when you think about conditions that develop, preeclampsia, diabetes sometimes can happen. You can utilize the BEMER. Sometimes I use it from the back for pain also, but the field will pulse all the way through to the fetus. So at this point, in my opinion, there has not been enough research for me to clinically use it in my practice, but off-site, if I'm not the doctor hat and I put it down, for sure. For sure. And there's many BEMER babies, meaning people can't get pregnant and they start to use the BEMER and then they get pregnant. And so this happens also. So no contraindication in the manual or the IFU, it's called a warning or a precaution. So that's the situation. It's under the warning and precaution section and not a clear contraindication one way or another. Again, that folds on you as the physician or doctor to make that call. Or, of course, the individual can say, I want to use the BEMER on their own also. Okay?
Eu gostaria de saber se essas duas frequências que o BEMER usa são fixas ou elas vão variando.
I can answer that. First of all, they are not fixed. These are proprietary guidelines of parameters of frequencies, which are patented. So I can't give you the exact shifts or changes, but it's around 10 hertz and around 30 hertz, and then there's a timeline of 120 seconds or 2 minutes, where these frequencies are generated and then they repeat each other. So they repeat over 2 minutes 4 times, which equals 8 minutes. The general recommendation is 8 minutes for a treatment, not 16, not 20. And then after you use the body, then sure, do a 20-minute, 16-minute. But yeah, the frequencies are changing and variable. The only fixed frequency, and it's not totally fixed either because it's around 10 hertz, is with the sleep program. Okay, it doesn't bounce between one and the other, but it's important. As you looked at the effects of the 30 hertz, 10 hertz range on nitric oxide, as well as the upper level brain control, the neural control of the vessel opening and closing. So they're not exact numbers, they're guidelines for you to understand the mechanism of action. Okay.
Posso falar? Eu queria fazer uma pergunta. Aliás, foi já falado algumas coisas sobre isso. Eu tenho um neto que mora em Santa Ana, na Califórnia, e ele nasceu com uma lesão cerebral e displasia do nervo óptico. Então, hoje ele está com 8 anos de idade, inclusive ele fez uma cirurgia agora, displasia do quadril. Então, assim, eu queria saber o que o BEMER, se o governo lá, porque você sabe das dificuldades, para ele ter uma melhora de qualidade de vida, porque ele não anda, né? Ele fez a displasia, a cirurgia para tentar andar, não come sólido há 8 anos. Então, assim, tudo. Eu moro aqui no Brasil. Então, assim, aquela preocupação. Quando eu conheci o BEMER, eu conheci através da irmã dela, que mora também na Califórnia. Então, eu conversei com meu filho, a possibilidade de ele começar. Mas é aquela coisa do descrédito, valores, né? Então, eu queria saber a possibilidade dele ter uma qualidade de vida melhor. Isso é uma coisa assim de coração, é uma coisa que eu me preocupo muito com tudo que acontece com ele, mas, enfim, queria que o senhor falasse alguma coisa.
Thank you for asking, and I know it means a lot to you as a family member. The therapy is available for everyone, okay? But the government, and I can only speak for the United States, does not pay for BEMER. You know here, it's the same story, okay? I don't have to stand here. There are companies who control and are involved with government policies. And we always say in medicine, it takes 20 years or longer for old ways of thinking to go away. I always say old medicine or old science dies with the people that are the scientists. So you have to wait for them to die, and then the new people come and make the new way. We are making a new way. Everyone in this room is a part of it, but it's a slow process. So can this improve his condition? I would hope it can. Can the government or Medicare, Medicaid, those type of things, do they pay for this? They don't yet. But we are working on this process, but it's a slow process. I've been using laser therapy for 15 years in clinical practice. 15 years ago when I started to use it, I got laughed at. They told me I was crazy using lasers on bodies until I started getting results, and I mean good results. And this is what it's going to take. It's going to take research. It's going to take money to do the research, and it's going to take people believing in a new way of doing things. All the ingredients are here today, and we will do better with this. It just will take time. Okay.
Ok? Ok, gente. Quem quiser, eu vou ter que parar agora, porque senão depois vai ficar muito tarde para o nosso coquetel. Eu só pediria uma desculpinha. Siga conosco lá para baixo, lá para o evento, e aí pode perguntar diretamente a eles. Pode ser? Pode ser? Porque... pode ser? Oi. Oi. Vamos deixar, então... Ok, então ele responde essa última pergunta agora, e aí nós temos... Oi? E aí nós temos... Oi? Oi. Ok. Ok, ok. Tá. Ok. Nós tínhamos... Ok, tá bom, então. Então, vamos colocar. Ok, pessoal. Então, vamos deixar. Vamos continuar com as perguntas. Pode fazer a sua. Não, desculpa.
Não, sem problema. Eu queria saber a respeito de prótese aórtica e prótese de joelho, fêmur. Estente aórtico e prótese de joelho.
One microphone is not working, so...
Prosthetic, implant. Yeah. There is no contraindication for any implant in the body. Okay? including even electrical or magnetic implants. However, it's important that if somebody has an implant that's magnetic or electrical, that they contact the medical device representative to find out if BEMER can be used. Maybe they don't know about BEMER though. No one knows about BEMER. So you say this: we're using a pulsed electromagnetic field device with an output power or flux density of 150 microtesla. Is this within the range of operation? I will tell you that it is. But maybe the companies don't, and the company can't say, oh, it's okay, you can use the pacemaker, you can use it with this. It's a caution or a precaution. But with stent, with hip surgery, all fine. You can go right over the top. This is not like ultrasound. And many times I will go right over the knee replacement, or right over the joint, or right over the disc. No problem. In fact, it's very, very good and beneficial.
Nós estamos só com um microfone, então quem quiser falar, por favor, venha até a frente e aí já consegue ficar aqui perto dele.
Na opinião dele, pode usar? Pode usar. Eu queria perguntar sobre pacientes com fraturas, se precisa a questão do gesso. Por exemplo, eu tenho um paciente agora que teve uma fratura de tíbia que está com um gesso enorme em toda a perna. Como é que se faz a aplicação em pacientes com fraturas e com gesso?
You mean like this one?
Yeah.
I showed him a leg where I had ORIF surgery, open reduction, internal fixation. 1 year ago, 1.5 years ago. So the question was, can you? When you have a cast. Yeah, cast. Yeah, the cast. The BEMER. Hold on. Does your cell phone go through the walls? BEMER is a radio wave, pulsed electromagnetic field. So yes, it will penetrate through cast. It will penetrate through brace. It doesn't matter. Sometimes if there's a cast, I go a little higher power. Directly over the fracture itself. And I have metal here. No problem.
Dr. Jorge.
Yes, sir.
Eu sou urologista, trabalhei muito com transplante de rim. Na sua apresentação, o senhor falou que uma das contraindicações do BEMER seria com transplante, porque vai chegar leucócitos, anticorpos, tudo no órgão transplantado. Isso facilita a rejeição, é isso?
So this is a relative contraindication. There has never been a case globally of a rejection of an organ or tissue transplant from BEMER, but the possibility is high, and so this is one of the areas or regions that BEMER says the line is drawn. Now, do people use BEMER that have had organ transplants? Yes, some do. But we, as the company, cannot support them. But I do know of people who use the BEMER and have had organ transplants and are taking immunosuppressive medication. So it's a contraindication for me as a doctor to say, oh, use this. But the patient says, hey, I want to do. What can I say? Okay, do. Oh, you have another one.
Boa noite. Qual seria o número máximo de sessões para cada programa? E, em caso de medicina preventiva, quantas vezes o senhor faria o programa ao ano? Uma vez por ano, 2 vezes por ano?
In a year or a day? Year. Twice a day. So BID would be 600 times or however many times. I use the BEMER every day. I don't sleep on the BEMER every day, but I use the BEMER every day at some level. Yeah. And when you are seeing patients, if you're working with the BEMER, you're getting the BEMER. Yeah. So there's no maximum.
Uma pessoa que toma imunossupressor, Xerelto e Rinoxavan, mas ele não fez transplante, posso aplicar o BEMER?
So the question was, for that you didn't understand, if someone is taking an immunosuppressive medication, for example, you said Revaxa, whatever you said, methotrexate, here's this, simple. People, there's a funny thing going on now with autoimmune disease. People think they have to suppress the immune system to treat someone that is overactive in their immune system. Even now, they use biologics to stop this process. For me, the smart thing is to look at what's the cause. Because in 15 years of medical practice, I have never, ever seen someone who attacks themselves for no reason. Never. Two things I see people with autoimmune. Something called molecular mimicry, where something looks like something, so then the immune system attacks it. And two, which is probably the most prevalent, is infectious disease. I'm saying this because I do not treat people with autoimmune disease like most other people by suppressing the immune system. And so if you're a traditional doctor doing it, that's totally fine by me. I have a different perspective. That being said, it is not a contraindication to use BEMER in an individual with autoimmune disease who's taking an immunosuppressive medication. BEMER has an immunomodulating effect in this way. Not pushing it up this way. You saw the pictures where the white blood cells were rolling. That means it's like the police on the street. It doesn't mean they're out on the street shooting. They're ready. They're ready and waiting for a problem. Very different. So I have never seen collateral damage or side damage from someone, let's just take rheumatoid arthritis, for example, or scleroderma, or other autoimmune diseases. I've never seen this get worse where the immune system is being amplified. It more modulates. In fact, I have seen people with RA come off the medication and have recovery, for example, scleroderma cases. So I would consider definitely using BEMER in autoimmune cases, for sure.
Gente, mas de verdade, agora, duas perguntas, ok? Quem quiser, quem tiver interesse, pode voltar amanhã. Vocês são bem-vindos, ok? Vamos lá, mais duas perguntas. Me perdoe, mas tem uma...
Eu gostaria de saber se tem sentido fazer, por exemplo, 3 programas P3 seguidos. Seriam 20 minutos cada. Isso foi orientação de um colega que tem muita experiência, lá de Goiânia, Dr. Marco Santana.
So the short answer is I don't do that clinically myself. Is there a negative side effect? Not necessarily. But what I do is I try to use the least dose, the least amount of dosage, to get the best result. And so 20 minutes back to back to back, it's not necessarily the way that I do it. If I did the B-body, for instance, with 8 minutes, and then I used the pad maybe for 20 minutes, and then did it again for 20 minutes on my leg, that's different than just doing the body. Now, there are other cases where I use the sleep program, and this is rare, where I use the sleep program in the daytime only for special athletes, meaning like professional golfer or somebody who is to use their brain to visualize, because it takes them into an alpha rhythm. 10 hertz is right around the alpha rhythm of human brain frequency. And so this is not, this is when you get ready to do something and prepare. This is alpha rhythm. And so you can really sharpen the brain by doing this. But like program 3, back to back to back, not necessarily, I don't recommend this. But if this doctor wants to contact me and talk to me about why he thinks this is a good idea, I'm very open. But I just follow the basic guidelines for many years, for 11 years, and I've had very good results in clinical practice. Maybe he has good results too, and if so, I'm very open and want to hear from him. Okay?
Doutor, desculpe. Eu sei que o senhor me respondeu a respeito do seguro lá dos Estados Unidos, mas a pergunta que realmente eu gostaria de fazer, qual a possibilidade do BEMER dar uma qualidade de vida para todos esses assuntos patológicos que eu falei dele? Porque tem pessoas lá que podem fazer isso por ele, entendeu? Então, qual a possibilidade? Isso para mim é importante.
Okay. This is probably the most important question that was asked today. Because so many people say, can I use BEMER for this? Can I use BEMER for this? Can I use BEMER for this? How do I do it? It will not hurt to try. I can't say, oh yes, this will definitely work and then it will only take 4 weeks or give you a prognosis of 6. I can't do this. I wish I could do this to you. But what I would say is have him try. Have him at least give an experience to try this. Because by doing it, he will know if he's getting better or not. And that's the only way. If you're a clinician using it, use the BEMER on people that you're working with to see these effects. I know that the BEMER works with so many pathologies. Like I said when I started this presentation, there's almost no patient or no individual that I won't use BEMER with. I just have to know how to do it and when to do it. So to answer your question, he should try this. Yes. And if you need someone or if you already know someone who's in the United States, definitely have them contact. Okay? You're welcome.
Ok, gente, muito obrigada. Eu agradeço.
Thank you for having me. Thank you for having me.
Eu agradeço pelas perguntas e pelas respostas maravilhosas. Todos estão convidados a voltar amanhã, se quiserem. E agora vamos descer, interagir um pouquinho, falar um pouquinho mais de BEMER.